North Carolina's hospitals and patients are facing avoidable harm. The federal One Big Beautiful Bill Act and a funding level disagreement in the recently passed mini-budget will lead to deep cuts in Medicaid unless policymakers act. Medicaid now covers over 3 million North Carolinians, including more than 650,000 enrollees since expansion. It's a lifeline in rural communities and for children, seniors, and people with disabilities. But with the state's stopgap budget, the North Carolina Department of Health and Human Services and the General Assembly are divided on the amount of resources needed for this year's Medicaid rebase. As a result, the department has announced plans to cut provider reimbursement rates starting October 1, 2025. A minimum 3% cut to all providers, with up to 10% for hospital and patient care, nursing homes, and some behavioral health services. These cuts may push providers out of Medicaid and reduce access, especially in rural counties. Looming over all of this is the One Big Beautiful Bill Act, which will tighten Medicaid financing even further. It phases down the provider tax safe harbor from 6% to 3.5% and caps new state-directed payments at Medicare rates in expansion states. That threatens North Carolina's hospital assessment and the Healthcare Access and Stabilization Program, also known as HAS, that helps hospitals cover Medicaid care. Fewer dollars in means less care out, and patients and communities pay the price. There's a better path forward, and we urge policymakers to work collaboratively with their provider partners to keep doors open and keep care local for the 3 million North Carolinians who rely on Medicaid. Without strong hospitals, our communities and our economy suffer. Protect North Carolinians. Protect Medicaid.